Hello everyone, welcome to another video. In today's video we're going to be talking about rheumatoid arthritis. So what is rheumatoid arthritis? Rheumatoid arthritis is basically one of the long-term autoimmune diseases, and it mainly affects the joints, and it can cause pain, swelling, stiffness, and it can also cause gradual destruction of joint structures. So in simpler terms, the body's defense system, that is the immune system, which normally protects against infections, starts attacking the joints by mistake, especially the small joints, like those small joints in the hands and in the feet. So rheumatoid arthritis is a disease that affects the whole body, not just the joints, and it basically causes inflammation, which means it causes swelling, it causes redness, warmth, and pain in the affected joint. So over time, this condition, it can lead to joint damage, it can lead to deformities, and can lead to disabilities. So it's basically more common in women, and it usually starts between the ages of 30 and 50, but anyone can get it. Anyone can get this rheumatoid arthritis, even children, but it's more common in this age bracket. So to understand rheumatoid arthritis, we have to first look at how the joint works. So we're looking at the anatomy of the joint. So a joint is basically where two bones meet, such as in the knuckles and in the knees. So there's a joint in the knuckle and there's a joint in your knee. So each joint basically contains the bones, that is the hard structure, the cartilage. The cartilage is like a smooth layer that cushions the bones so that they don't rub against each other. So it's like a lubricant. Then we have the cartilage is not a lubricant. It's like cushions. I don't know which word to even use. It's the synovial membrane, that is a thin layer that covers the joints and produces synovial fluid. So this synovial fluid is the lubricant, because it lubricates it keeps the joints lubricated and allows smooth movement. But the cartilage is different, so it's like a cushion. So maybe I could call it like a shock absorber or something like that. So it prevents the bones from rubbing against each other. And then we have the bones, the cartilage, the synovial membrane, which produces the synovial fluid. Then we have the ligaments and tendons. So these ligaments and tendons, they support and move the joint. So in cases where a patient has rheumatoid arthritis, the immune system attacks the synovial membrane. Synovial membrane is, like I mentioned, is like the thin lining that covers the joint and produces synovial fluid. So the immune system attacks this synovial membrane, causing it to become inflamed and thickened. And because this covering is inflamed and thickened, it will lead to damage to the cartilage and the bone, because what is keeping what allows smooth movement is not functioning properly. So it leads to damage to the cartilage and the bones. It leads to pain and swelling and joint stiffness and deformity over time. So basically that's the breakdown. So looking at the causes and the risk factors of rheumatoid arthritis. So usually doctors don't know the exact cause, but several things can increase the risk of developing rheumatoid arthritis. Like, for example, having a family history. So genetics can be a risk factor. Then, like I said, it's more common in females. Then also smoking cigarettes, being obese, and some certain infections can trigger it, and some certain hormonal changes, especially in women. So looking at the pathophysiology, like what exactly happens in the body when someone has rheumatoid arthritis. So the immune system kind of gets confused and it starts attacking the joints. So inflammatory cells, they enter the joint and release chemicals that cause pain and swelling. So the synovial membrane becomes thickened, forming a layer of inflamed tissue called a pannus. So this inflamed tissue, this pannus, it grows and it damages the cartilage and bone that is underneath it. So over time, this leads to like joint deformities, and it can also lead to loss of movement. So looking at the signs and symptoms that we see in this condition, so there will be pain in the joints, especially the small joints of the hands, the wrists, and the feet. There will be swelling and warmth over the joints. There will be stiffness, especially in the morning, lasting more than 30 minutes. Then there will be tiredness, like generally feeling unwell. Then there will be presence of low-grade fever in some cases, and the patient will also have weight loss. Some patients will have weight loss. There will be joint deformity in severe stages of the disease or in the late stages of the disease. Then there will be there can be presence of firm lumps under the skin near the joint, and these lumps are known as rheumatoid nodules. So these are all the symptoms that you probably possibly see when a patient has rheumatoid arthritis. So let's look at like the conditions that we have to rule out when we are diagnosing rheumatoid arthritis. There are other conditions that can cause joint pain or joint swelling, which may be mistaken for rheumatoid arthritis. So for example, we have osteoarthritis. Osteoarthritis is like the wear and tear arthritis that comes with aging. So it has to do with more of the bones, and it usually comes with aging, so it's more prevalent in like older people. Then we have then we have systemic lupus erythematosus. It's also another autoimmune disease that can come with this joint pain and swelling. Then we also have psoriatic arthritis, which occurs in people with psoriasis. Then there's also gout that is caused by like uric acid crystals that are present in the joints. Then there's also viral arthritis, so joint pain caused by certain infections. And then ankylosing spondylitis. So ankylosing spondylitis is like arthritis of the spine and the large joints. So all these conditions, they usually come with joint pain and joint swelling, and they can be misdiagnosed with rheumatoid arthritis. So for the diagnosis, basically there is no single test that can confirm, okay, this person has rheumatoid arthritis. So doctors use like a combination of tests and signs, like for example blood tests. So these blood tests, they usually help to detect inflammation and immune system activity. So there's something known as rheumatoid factor. So is an antibody that is often found in patients that have rheumatoid arthritis. So when this rheumatoid factor is found, there is like one of the positive signals that, okay, this person has rheumatoid arthritis. Then there's also another antibody known as anticyclic citrullinated peptide antibody, anti-CCP. So it is a more specific antibody for rheumatoid arthritis, more specific than the rheumatoid factor. Then we also have C-reactive protein and erythrocyte sedimentation rates. So both of these are also signs of inflammation that can be seen. All these things can be seen in like a patient's blood test. Then we also have imaging scans. So x-rays can show like bone and joint damage. Then magnetic resonance imaging like MRIs and ultrasounds, they can also show inflammation and early joint damage. Then we have the physical examination. So physical examination, the doctor can check for joint tenderness, swelling, and symmetry, whether like both of the joints are affected. So for the treatment, basically there is no cure, but Early and proper treatment can reduce pain and slow down joint damage and also improve the person's quality of life. So some medications that are given, so we can give anti-inflammatory drugs like ibuprofen, diclofenac, which help to reduce the pain and the swelling. Then we can give steroid medications, so like prednisolone, that have like strong anti-inflammatory effects, and but it's usually used in short term. Then for them, we also use this particular group of drugs that are known as disease modifying anti-rheumatic drugs. So they are specifically used for rheumatoid arthritis. For example, methotrexate, sulfasalazine, leflunomide. So these are basically specifically used for rheumatoid arthritis. So they slow down the disease and prevent further damage. Then we have biologic drugs like adalimumab, etanercept, or infliximab. So this group of drugs, they target the specific parts of the immune system, and they are used with they are used when other drugs fail to work. Then we also have another specific group of drugs known as Janus kinase inhibitors. So an example is tofacitinib. So tofacitinib is an example, and it blocks signals. It basically blocks signals that cause inflammation. So methotrexate, which is an disease modifying anti-rheumatic drug, it is often the first drug that is used in cases of rheumatoid arthritis, and is usually taken once a week, and is usually often combined with folic acid to reduce the side effects. So non-medication management that we could do, for example, we could do physical therapy to improve the movement and the strength of the joints. Then occupational therapy to help with daily tasks and joint protection. Then doing regular gentle exercises like walking or swimming. So these exercises can be very helpful. And weight management, so if the person is obese, for example, so we can practice weight management to reduce the stress on the joints. Then we could use supportive devices like braces, splints, or some kind of special shoes. Then in severe cases, surgery might be needed, only in severe cases. So there will be need for joint repair or replacement of the joints. And then in a simple language, this rheumatoid arthritis is a condition where your body fights against your own joints, and this causes pain, swelling, and it makes it hard for you to move that particular joint. But with treatment, especially if the treatment is started early, you can still live an active and healthy life. But there's no specific cure for it. So early diagnosis and treatment can stop the disease from getting worse, not eradicate the disease completely. So it can stop the disease from getting worse. And some people experience remission, sometimes there will be no signs of the active disease. And usually, if rheumatoid arthritis is left untreated, it can lead to permanent joint damage and disability within a few years. So in summary, this rheumatoid arthritis, what type of disease is it? It is an autoimmune disease. It's an inflammatory disease. What are the main areas affected? The joints, especially the hands, the wrists, and the feet. What are the symptoms? Pain, swelling, stiffness, fatigue. Is there morning stiffness? There's morning stiffness, and it usually lasts for more than 30 minutes. What blood tests are done? In the blood tests, we check for rheumatoid factor and anti-CCP antibodies. Then treatment, disease-modifying anti-rheumatic drugs, anti-inflammatory drugs like prednisolone, NSAIDs, and some biologics. And what is the long-term goal in this condition is to control the symptoms, prevent joint damage, and basically to maintain the function of the joints and the movement. So that is the breakdown of this condition known as rheumatoid arthritis. I hope I was able to make it clearer for you. So I'll see you in the next video. Thank you for watching. Bye.